Welcome everyone to 10 Across Conversations. Today we're going to have a really informative conversation on extreme heat and what some of our extreme heat officers, sustainability officers are facing as they develop strategies to help mitigate some of the issues that we're experiencing there. So today I'd like to introduce two of our 10 Across Resilience Network members. One is Marta Skura, the Chief Heat and Climate Emergency Mobilization Officer for the City of Los Angeles. Good morning, Marta.
Good morning, Ray.
And Doug Melnick, the Chief Sustainability Officer for the City of San Antonio.
Good morning.
Thank you both for joining me. So first, what I'd like to do is really provide some context in terms of what the role is that you play within your cities, how you interface with different departments to be able to do the work you do. So Marta, why don't we start with you? Kind of explain to us what exactly your role is, who you work with, not just in the city, but possibly in the county, the state as well, so we get a better picture of exactly what's in your portfolio.
Well, this position launched for Chief Heat Officer in 2022, but I was already the Director for the Climate Emergency Mobilization Office. So we realized in Los Angeles that climate emergencies were and are a very big part of the work to mitigate climate crisis. However, there was a LA Times report that demonstrated that there were too many deaths and too many injuries in Los Angeles, and something had to be done that really addressed extreme heat because that was our priority climate hazard. So then that's when the council passed a motion to appoint me as Chief Heat Officer for the City of LA. But yeah, we work with multiple departments. One of the most important ones is emergency management because they, under the charter, already address climate hazards and disasters and emergencies. So they've included the Chief Heat Officer. I'm one of the advisors to the Mayor's Office for identifying cooling centers throughout the city when there is a heat alert. I'm on the team when the National Weather Service calls and advises us when there will be a heat alert. Of course, we're in the Department of Public Works, so most of the Public Works Department is addressing the infrastructure issues that we need to modify, decarbonize streets, decarbonize transportation, decarbonize buildings, plant more trees, all those nature-based solutions. So there's a lot of coordination with Public Works as well. And then, as you can imagine, Rec and Parks and the Department of Transportation have their role as well to increase shade equity, to reduce GHGs, and to ensure that the transportation system, first mile, last mile, reduces the amount of time pedestrians have to be on the streets walking so that they can get to work without being completely exhausted from extreme heat or any extreme weather condition. And to do all of that, we are launching a heat action planning process. We just completed our heat action framework, and we're going to be doing it under the Mayor's Climate Cabinet with the support of the Office of the Mayor.
And Doug, can you tell us about your role as being a Chief Sustainability Officer? I imagine your portfolio might be similar but different, and then also help us understand how you're working within the structure of San Antonio's government system.
Right. Yeah. Like being a chief sustainability officer, every day is different. We are lucky enough to have a decent size office. There's 13 of us, and we really are combination of facilitators across the organization, as well as with partner stakeholders and the community, and then we drive programs that we own. So, for instance, as Marta had mentioned, decarbonization is a huge priority. We have limited direct control over things that are going to result in decarbonization. However, the role that we play is working across the organization to ensure that departments are thinking about decarbonization and helping to provide them the tools to meet those objectives. So a simple example is one of the goals in our city's climate plan was to decarbonize the city fleet. Um, we spent a couple of years working with our fleet managers in other departments on what that process looks like, looking at best practices, looking at policies from other cities, developing a system and policy that is going to really drive that decision making to get to where we need to be. And it worked. It took a lot of time because there's a lot of education and there's a lot of um, work just creating those collaborations and making sure lawyers, fiscal, the largest fleet operators in the city are part of the conversation. But we ended up now with a policy that has a separate oversight committee with very clear standards that we are going to prioritize zero emission vehicles first. The thing that's been so fantastic is we sort of look at ourselves as consultants. We'll come in, we'll provide advice, we'll provide a framework, but at the end of the day, we don't own it. We are not responsible for decarbonizing the grid, but we can work on our own city facilities as well as working with our utility on really coming up with those measures. So basically, that's the way I see us as the technical advisor within the organization that's really focused on meeting not just mitigation goals, but also, as we're talking about here, adaptation and heat resilience goals.
Would it be fair to say then you're not necessarily making all the decisions, but you are kind of like the master orchestra leader, really kind of bringing in all those different departments, getting them up to speed, giving them the information they need, and then really helping to coordinate those efforts within the cities?
Exactly, and I would think Marta would agree. I mean, these departments are focused on delivering very specific things, and they don't necessarily have the time or the wherewithal to think about how their work touches on other things. And it's as simple as, okay, getting all the right players within the organization around the table to talk about heat and
Yeah.
what is it that their role um, um, uh, has in terms of influencing heat mitigation. And it's just bringing it all together and coming up with clear objectives and expectations and tracking progress. It's about when we look at the financial need that our cities have in terms of making sure that our communities are heat resilient. We need to leverage the resources we have, and so we just need to look across our organization and with partner agencies. How are we using the dollars that we have most effectively?
Mm-hmm.
Right. So now I want to shift to really looking at what we know about heat and how we know it and how that helps inform strategies moving forward. So, unfortunately, we know that extreme heat is the number one climate killer here in the United States, right? Over any other climate related disasters, hurricanes, wildfires, tornadoes, etc. And in fact, just in the last 2 years, the US Department of Health and Human Services noted that there's been an increase from 1,602 deaths in 2021 to 2,302 in 2023. So 47% increase.
Mm-hmm.
So tell us why heat is the deadliest. What is it about heat versus some of these other climate related disasters that makes it so deadly?
Yeah.
Marta, let's start with you. And then Doug, I'd
Sure.
like to hear your thoughts too.
Great. Yeah. Well, heat is definitely a public health risk and a public health concern because if you think about a city and its already most vulnerable areas that lack air conditioning, have pollution burden, also have more people in those areas with pre-existing health conditions, all of those uh, multiple factors combined are this cumulative impact. So when heat arrives in an area such as Los Angeles, in a dense urban area, and there's already particulate matter and air pollution in the air, or the ozone is really high that day, in addition to wildfires being nearby, then that heat catalyzes the exposure level to the individuals. It hurts even people who are healthy, much more so than if you're not. And so we have more emergency room visits in those heat vulnerable areas. We have more preventable deaths in those heat vulnerable areas. But I think it's been the silent killer, because if you have heart disease and you are in the hospital and that's where you pass away, then they're going to say, oh, they died of a cardiac arrest or they died because of kidney failure. And then I was talking to somebody from FEMA the other day, and they were getting ready for the hurricanes. And I said, are you ready for the heat? And he's like, oh, no, we're ready for the hurricanes. I'm like, let's talk about that, because
Mm-hmm.
it's heat that kills most people after a hurricane,
Right.
right? Because of the lack of
Right.
the outages, the lack of air conditioning, the lack of water and other resources available, and all those multiple factors that I just mentioned too. All the
Yeah.
pre-existing health conditions, all of the environmental conditions that are already there are. And then if your humidity level is higher, obviously your body's not going to be able to resist it as much as if the heat is drier, right? But both are very dangerous. And in LA, we're lucky to have a UCLA heat map, and they identified risks, the excess deaths and hospitalizations over the last 10 years for the entire state of California. So we're
Yeah.
really fortunate to have that data, but we need more of that data, and we need it
I,
more consistently.
yeah, I want to touch on that in a minute because I think there are
Mhm.
some insights there that would be helpful. Doug, do
Great.
you have anything to add
Yeah,
to
and
that?
I was just sort of reaffirm what Martha was saying is we I don't think we really understand the true public health impact just for the reasons outlined, because it's what is a heat related death, and so while we've seen an increase in reported heat related illnesses and deaths, what about all those others that aren't being reported, or we definitely know that this is a major concern. But the other thing I just wanted to add is our community is concerned about utility costs. I mean, there's that's the number one thing when we've been sort of
Yeah.
surveying the community about their concerns around heat. The
Mm-hmm.
other thing is, as to Martha's point, there's tremendous number of residents who don't have air conditioning. So what are we
Mm-hmm.
doing for them? And then the third thing I would just mention, we sometimes don't think about, is just the cultural impact. People are missing. People are isolated in their homes
Mm-hmm.
due to heat. And one of the phrases that I thought was so interesting that some community members used was, you know when we asked them to describe what heat means to them during the summer, and somebody had mentioned it's like being snowbound by heat.
Yes.
And so San
Mm-hmm.
Antonio is a very culturally diverse community where people like being part of their community and getting out and engaging, and we can't, and they can't. And so there's public health impacts, but there's also cultural impacts that are as devastating.
Right.
Yeah. So let's talk about that. The actual data that you are tracking. You've touched on
Mm-hmm.
some of that already. What, as kind of the leads in your cities focusing on extreme heat, and I understand there's other departments that are working with you, but
Mm-hmm.
what are the metrics that you're looking at to help you understand where your challenges are, where you need to prioritize, how, to help you in terms of your long-term planning, because certainly there's infrastructural considerations, etc.
Mm-hmm.
Give us a sense of what are you looking at, and to your point, Marta, where are the gaps, right? What are we not able to get right now, or maybe we need it more in more real time or sooner than a year out, 2 years out? Sorry, loaded question, but I think it's an important one because certainly helps us make smart decisions, right?
Mm-hmm.
So Doug, do you want to start with that one?
Yeah, and that's a big question, because that gets to, I think, to your point, heat cuts across so many different entities, and everyone has their own data. And so I think that's one of the things we're still working through. What I could talk about is what our office is doing related to heat mitigation activities. So that the whole heat response side um, is really our health department, our Office of Emergency Management. We're focused on trying to prioritize specific interventions. And what we did was we worked with our local university, University of Texas at San Antonio, to use satellite data to map surface temperatures, and then to correlate that with race and income. And so we could start really figuring out where target areas are,
Mm-hmm.
and then brought other variables into that equation, including tree canopy, impervious cover. How do we figure out where do we start first? And so what we will be doing is we've identified a handful of neighborhoods that we are working with, starting with community engagement. We want to understand how
Mm-hmm.
these communities perceive heat in their neighborhoods before coming in with interventions. But the goal is to begin deploying numerous interventions, weatherization, rooftop solar, trees, shade structures, reflective pavements, reflective roofs, um, while continuing to work with our university partner to measure. And so part of this
That's key.
project is going to be deploying air quality and temperature sensors in various residence homes, internal and external, and then have real time data. When we start deploying interventions and we start hitting certain thresholds of canopy or reflective roofs, or percentage of homes with certain minimum weatherization, what does that mean for ambient air temperature? So we're just trying to sort of tease
Mm-hmm.
out what those various options are and what we can expect for impact to better inform. I think my personal goal is to come up with a some sort of formula based upon different neighborhood typologies that can help inform sort of minimum standards that we need to shoot
Mm-hmm.
for in terms of canopy, impervious cover, and other interventions. So we're trying to use the data to help inform our implementation, but I think we're figuring it out as we go at this point.
Mm-hmm. Yeah. I want to say
Awesome.
that not all data is relevant, and not all data really gets to what we're trying to do. We're trying to create more livable, walkable, resilient communities and cities that can withstand, right, the increasing temperatures as we move forward. So we're really trying to focus on public health, public safety, and livability. And if
Mm-hmm.
that is our goal, that is our end goal, then just looking at one set of data is not enough. We need to look at a multifaceted layers of data that give us that end goal of thriving, healthy, livable communities. Why I say that is because, and this is a bit controversial, but cool pavements during the day are, yes, their surface temperature is cooler. But if you're a pedestrian and you're walking on that, you're going to get more radiation
Yep.
from
Mm-hmm.
that cool pavement. So
Mm-hmm.
is it more walkable during the day? No, it's not. Is it reducing the heat for the pedestrians and people using the streets? No, it's not. So, uh, so when we're piloting projects like cool pavements, we then need to look at, so what is it that, um, what other impacts might this have that we're not thinking about? It's made of acrylic, right? Is that good for the environment when it deteriorates and goes into our water system? So let's put cool pavement aside for a second. I just want to basically say that we need multifaceted approaches and multifaceted data. Dr. Kelly Turner at UCLA is taking that public health approach, looking at variables of multiple types of interventions that actually are tried and true, that can reduce urban heat, right? So, for example, near surface air temperature, that's breathing level.
Mm-hmm.
We need to really understand what's the near surface air temperature, and we also want to understand this public health data that I was talking about earlier. Right now, we have excess number of deaths and excess number of injuries during the heat wave. But like Doug was saying, it's a correlation and it's an
Right.
acceptable standard of data because epidemiologists use it for pandemics, right? So
Right.
it is an acceptable standard of data, but some scientists want to see a more direct correlation. I don't think we have time for that more direct
Mm-hmm.
correlation if we want to save lives, if we want to start intervening now, right? So I am
Mm-hmm.
not waiting for that data. I can see that the correlation is strong enough. And there's a lot of great data out there demonstrating the vulnerability of people with pre existing health conditions in what we call frontline communities or environmental justice communities. And we already need to accelerate climate interventions in those areas anyway. So what we're advocating for in Los Angeles is to invest first and foremost in those vulnerable communities, because that will get you the biggest outcome, not just for that community, but for the entire region. Because if we need shade there, if we need trees there, if we need nature there, that nature and those trees are not just going to cool people, yeah, and cool the pavement and cool the city. They're also going to provide stormwater solutions. They're also going to provide aesthetic solutions. They're also going to be it's going to be a more biodiverse community, which is what everybody is sort of shooting for, right? A thriving, healthy ecosystem and community for all. And then if you can envision from a bird's eye view, not in the beginning, you'll have pavement and concrete jungle in one side of the community, and the other is beautiful with trees and shade and nature. You want all of it to look like the one with trees and shade and nature.
Mm-hmm.
So that bird's eye view is spread across, and then you have your outcome that you're looking for. So I know I stayed kind of general there in terms of what data do we really need, but the reality is we need to ask ourselves that question first. What is the outcome that we're looking for? Because, for example, and I'm just going to say it, MIT had some data that Bill Gates was repeating that trees were not really all that great,
Yeah.
right? You know, many scientists across the world challenged that immediately, right? Because they were looking at it from a very narrow scope, right? We cannot do that with public health and with the kinds of outcomes that we're seeing. We need a more varied scope and multifaceted solutions and data.
And if I could just sort of jump on to those little points, just to sort of confirm what Martha was saying is one in term there's no, and this is one of the things that we always talk to people internally and externally. There's no one solution.
Mm-hmm.
I think it's very easy for us to say cool pavement is going to let's
Solve all the
deploy that,
problem. Yeah.
and
Yeah.
Martha's exactly right. It radiates heat, right? So what we tell different stakeholders is there's a place for cool pavement, but not every place is necessarily the right place for cool pavement. If we're talking about
Mm-hmm.
real high pedestrian activity areas, no, that's not going to improve comfort. So I think I think that's what we're trying to figure out is, and I think cities are trying to figure out. Okay, it does do something, but what does it do well, and what does it not do well? So I think I just wanted to reaffirm that. And then the last thing I wanted to mention was, again, the importance of talking to the community, right?
Mm-hmm.
I was, if I'm looking at a neighborhood, I don't want to be the one to basically take a look at a bunch of maps and take a look at a bunch of data points and say, you know what, this corridor is the important corridor that we need to do,
Yeah,
without talking to the community,
that's
because
right.
they know where the major bus stops are. They know where people are walking to go get, services. If we
Mm-hmm.
don't talk to them first, I think we're not doing ourselves any favors.
Mm-hmm.
So, so,
Agreed. Mm-hmm.
so to that point, then, you've both brought up this equity issue with heat. And I know you are working on certain strategies to try to mitigate some of the impacts of extreme heat in these underserved communities. Can you talk about some of the work that you're doing there, how you're assessing where you're prioritizing your work? I mean, the data is telling us this is where we need to focus first. So, what are some of the things that you're doing there to help mitigate
Again, in
heat?
LA, we're really fortunate that both the city and the county care about extreme heat. So the county did a climate vulnerability assessment a couple of years ago, even before they named me chief heat officer. But when I started my role, we started doing surveys and focus groups, and we have a report called "Turning Down the Heat."
Mm.
That's basically a focus group led report, community driven report that we did in multiple languages in the most vulnerable communities in coordination with UCLA, their support. So we have that. And the Department of City Planning just completed a draft of a climate vulnerability assessment. And even though it was for multiple climate hazards, the hazard and the hazard that came up the most was extreme heat. and the solutions from the community that were discussed the most were for extreme heat. So actually, it's in my inbox. I need to review it. I need to get back to it. But like Doug was saying, it's extremely important to hear what communities are saying, how they're experiencing it, what solutions they're presenting, so that we can prioritize the types of interventions that we bring to those communities. I think that's really important because when the community acknowledges and recognizes that the city is listening, and then we're bringing them the solutions that they've suggested, not just what we think they need,
Mm-hmm.
then I think it's a win-win situation. So for example, as we pilot cool pavement, I understand that we need to put it in this area and in that area. But I've heard some cities say we're going to invest at first in vulnerable communities. Well, that's where the pedestrian traffic is high. You know, is it really that smart to put it there first?
Mm-hmm.
And then there's the expense. I think we need to talk about the cost. We've already informally realized, my gosh, it deteriorates quickly and it costs a lot of money. Is it really worth the cost benefit um, of the impact that it will bring? Because what it does do is it cools the pavement. So at night, you get this cooling effect, very minor, but you do get the cooling effect at night, right? So I really like what Doug was saying. We need this multiple solutions, multifaceted approach. It could be appropriate for some areas, but you know what's appropriate for all areas that's a surface is cool roofs. Cool roofs is, and why? Because you're not walking on roofs, right? So you're not radiating that heat onto bodies and people. It's just going back into the atmosphere.
Mm-hmm.
So it's a very different, and you don't have cars and trucks deteriorating that material quickly. So it's a very, very different analysis that I have for cool roofs versus cool pavements.
So, with some of the strategies that you're both putting in place, where are you seeing success? Where is success happening? You know, where you talked about measuring, you're trying different things, different combination of
Mm-hmm.
strategies. Where are you seeing some success happening? Doug, do you want to start with
Yeah,
that?
I mean, I think success is a tricky word.
Okay.
And after doing
Progress.
progress, I mean, I think for me, the simplest success to see at this point is the fact that there is, at least appears to be, unity within our organization, with city leaders, with most of the community, that extreme heat is a major issue. And and one of the things, again, being being in South Central Texas, it's always hot, right? When I
Mm-hmm.
got here 10 years ago, and I was trying to talk
Mm-hmm.
about what we need to prepare for, and it was fairly disregarded. I mean, it's hot. It's always going to be hot in San Antonio in the middle of the summer. But I think it's gotten to the point where people are realizing that's not the case, that things are changing. So I think there is a degree of support that, yes, we need to do something. In terms of where we are right now, we've got the buy-in to go through the planning process and to start deploying. And so I'm hoping by next year we'll have more concrete results. I think we're still very early in our journey around how do we address complete um, extreme heat? And my goal is getting to the point where we are designing and redesigning our cities around heat.
Mm-hmm.
Looking at building codes, looking at there needs to be standards in place for our infrastructure addressing heat, so we're not just constantly going back and retrofitting. That's not the most cost effective thing. So for me, the big success is there's buy-in, there's movements, there's a degree of allocation of resources. That bodes well. But as far as, do I know if all of this is going to work, and to how much and what degree, I don't quite know yet.
Mm-hmm. Yeah.
That's a very honest and fair answer. I think from what I've heard from many that are in your positions in other cities, you're all kind of creating these plans. I mean, they're relatively, I mean, not brand new, but they're relatively new. You're trying to iterate, learn. So in a way, there's still this in the beginning stages.
I mean, to Martha's point, we know what we need to do, right? I
Right.
mean,
Yeah.
we need to do what we haven't been doing. It's just the will to do it.
Sure. Well, I will say a big part of another big part of my job is heat risk communications, right? Because Doug's right. People say, hey, California is usually hot in the summer. What's the big deal? Well, guess what? So you give them the statistics, you give them the numbers, you let them know how many more people are actually dying from extreme heat. Why having more pre-existing conditions in our communities is increasing that number. If you talk to them from a public health perspective, people begin to understand that this is something that we need to change. However, it is sort of a different turn for most general managers and departments because all this time they've been focused on reducing greenhouse gas emissions. Well, as an environmental health science expert, I always knew that that was too narrow of a focus. We need to move beyond GHG and ESG, and we need to begin to look at this more holistically and what creates a thriving, healthy community. And, we still have air pollution. In fact, we may have more different types of air pollution than we ever did before. And so it's very important to convey those risks, convey them accurately so people get the urgency. And I think that that is a success. That is a breakthrough for most of us that are working in this field because the urgency then accelerates those investments in the areas that they're most needed. And since you asked about progress or
Mm-hmm.
success, we now have $80 million to build bus shelters with shade in the areas that most need them. We have another $80 million investment in Metro to create more electric fleets. We have another few hundred million that are coming from the federal government to electrify all fleets in LA County, right?
Mm-hmm.
So that both reduces GHGs, but also ensures that people have that first mile, last mile access and have less. I mean, it's great to exercise and it's great to walk, but not when there is a heat alert, right? So we
Mm-hmm.
want to make sure that we have enough public transportation to create a more livable, walkable city of the future.
Yeah.
And then there's a lot more I can say about decarbonizing and the long-term solutions and what our heat action plan is proposing, because the strategies that we're proposing, like Doug said, are things that the city is already committed to. We're just focusing them on the heat mitigation strategies that need to really accelerate the solutions of the future.
Is it accurate to say your heat action plan is kind of the first in California and that will be rolled out to other California cities as well, being used as kind of
Yeah, I
a,
think we'll be the first city in the
yeah,
West Coast
yeah,
actually to have an actual heat action plan. And we do want ours to serve as a learning curve or model for other cities. And there's 88 cities in LA County alone. So
hmm,
even if we just influence the 88 cities in LA County, that would be huge, right?
yeah, yeah.
So,
So taking it from at the community level, and now let's go up to the federal
mm,
level, federal government. We think just last week we had the Secretary of the U.S. Health and Human Services Department here in Phoenix, who was really trying to drive home that we needed to emphasize this being a public health crisis, extreme heat, and that it's not only a health crisis, it's causing new natural disasters because of heat, and that there needs to be addressed in laws and policies. So
mm,
as we think about, we've had conversations and are in conversation with
mm-hmm,
FEMA, right, about what can be done to help support some of these extreme heat incidents, thinking of them as disasters and what resources needed to be deployed to support that. And at this point, the Stafford Act doesn't necessarily recognize extreme heat as a disaster. Um, how do you feel about that? Do you think if extreme heat were uh, part of that act, would that be helpful to you in the work that you're doing in terms of getting needed resource to support what some of the
yeah.
impacts of extreme
Well,
heat?
I think absolutely, and I do see some progress being made at FEMA, and
Yeah,
they're very aware
same.
that
Yeah.
more data is necessary. In fact, I just got an email today of all these data tools that they're creating for extreme heat that I also need to take a look at. But for example, that conversation with the FEMA guy that oversees hurricanes, he acknowledged that the majority of the disaster happens after the hurricane, right? And
Mm-hmm.
so if FEMA could distinguish, right, when there's extreme heat, even if it's coupled with a tornado or a hurricane, and separate those two as distinct disasters, then we could potentially get more funding for extreme heat as a whole. But yeah, we need it for not just for our cooling centers and shelters, but to repair infrastructure, to make sure that our hospitals and our clinics have the capacity to
Mm-hmm.
take the people that are being injured and harmed by extreme heat. And this is just the beginning, right? This is just the very beginning, the tip of the iceberg, so to speak,
Yeah.
of the kind of injuries and illnesses we're going to be seeing moving forward. So we have to definitely, hopefully, rely on FEMA in its current version or maybe a future version that, again, is less siloed and coordinates more with Health and Human Services and other departments so that we can get this right.
Yeah,
Yeah. Which is,
and just 100% agree. I mean, the thing that scares me is, you know, heat is such a big term, but all the cascading, events associated
mm-hmm.
with it, wildfires, right? Just take a look at a map of North America, droughts. This is, it's not just heat. It's all the other things that are downstream from it. So we
Mm-hmm.
definitely need federal leadership and support because when we're working at the local level. We have limited resources, and then this is we haven't even spoken about the our electric grid and then the ability to provide this power. So it's again, if heat is one of the major critical risks that we face, it has to be prioritized. And again, to sort of reaffirm Martha's point, at the end of the day, who's going to suffer the most? And again, it's those frontline community members.
Mm-hmm.
But it's going to affect everybody.
what I'd like to wrap up with is, knowing that your cities have been on the front line with extreme heat, what wisdom can you share with cities up north, upstream, that the heat is coming, right? We know the globe is warming. We know we're going to have to deal with this. What can you share with them in regard to how they need to start thinking about how they prepare for heat? And it's coming. I mean, we're hearing it already.
Yeah.
Northern cities that don't have air conditioning and they're getting this extreme heat that they've never had before. What
Yeah.
what could you share with them?
I think that what the city of LA is doing, and I think this is a model for other cities, is we're we're prioritizing and accelerating climate solutions that overlap with extreme heat, some of which we already have funding for. And why we're doing that is because even those projects are having difficulty getting funded. So if we sing as one chorus, this is the these are the strategies that we're prioritizing. And we need FEMA money, we need health and
Mm-hmm.
services money, we need EPA money, we need DOE money to create a financial package that supports all of those infrastructure changes, but then accelerates them. Then we are doing this phenomenal thing called plan alignment, right? Goal
Mm-hmm. Mm-hmm.
alignment. We are working together as one to ensure we save the most amount of lives, that we repair as much as we can for our city, and prepare as much as we can for the future heat waves. But we don't, I think most cities still don't have an accurate cost analysis of what it will cost to transition to become a heat resilient Los Angeles or heat resilient San Antonio. So we need that kind of data as well, so we can have a better estimate of what that transition will cost. Like, for example, if we want decarbonized buildings, decarbonized apartment units, we are doing a pilot project through the Department of Water and Power, funding and subsidizing these low income multi units to see what kind of a financial package did we need to pull together to get that entire unit decarbonized and more heat resilient. And then if we do enough of those, that'll give us an estimate for what it's going to cost to transition all of them and by when. So we need that kind of cost data very quickly. But I guess just to put it in plain words, plan alignment, with these heat action plans will be critical for all cities so that we can maximize and accelerate those goals and get them
Thank you.
done.
Doug, you've got like
No, and I
one
just,
minute.
basically that, I agree 100%. Coordination, communication, leveraging resources, and again, to Martha's point, what's the plan? And really understanding the implications of what implementation looks like, because it's until you, and that's sort of what we're trying to do is understand if we do X, Y, and Z, what can we expect? But more importantly, what are the costs, and then how do we scale it up? And I think that's where we're at.
Great. Well, thank you both very much. Very informative conversation to me, and I'm sure many of our, if not all of our listeners. So we appreciate you taking the time meeting
Great.
with us, and
Thank you.
we look forward
Thanks
to
so
sharing
much.
this with everyone. Thank you.